Okay. How is India doing when it comes to survival and medical science? बाकी countries के comparison में, where does India stand?
Yeah. So I think that's a good question. So outcomes for cancer has been improving across the world. Even if you look at, so we all might be thinking that, chalo, US is doing very well, countries like UK might be doing very well, Japan might be doing very well. But in fact, even countries like Sub-Saharan Africa are doing better. So if you look at a country, maybe in the middle of Africa, where earlier children with cancer, 90% might be dying. Nowadays, even for them, the survival is on an uptrend. So India is also somewhere out there. So what I would say is that if you stratify the survival of countries from the countries which have the best survival, which you might think of countries like the US or Japan, to the countries which have the worst survival, where you would have countries like maybe Sub-Saharan Africa. So India would definitely lie in the top 20% on this graph. So that does not mean there is not work to be done. We need to reach the top 1%. That's what should be our long-term goal. But we are definitely ahead of the pack, and India is doing quite well. The reason why Indian patients might be doing poorer compared to patients in, say,
Outside countries.
Outside countries also, we need a qualifier. I would use the word rich countries like United States or Japan. India is rich in its own way, but per capita we are still relatively poor.
Of course.
So compared to those countries, mainly the first major problem is lack of awareness. Let's take prostate cancer as an example. So in US, people are very aware about prostate cancer. They do their annual blood test and they catch it on time. They do their screening. They catch their cancer in time. Majority of patients, they are diagnosed in very, very early stage. While in India, the same cancer, most patients are diagnosed in stage 3, stage 4. Because they are diagnosed late, they do worse than the same kind of patient who are diagnosed in United States. So I think the number one cause is not money, it's lack of awareness, due to which patients are unfortunately diagnosed at an advanced stage compared to other countries. But another thing is the kind of resources the country has to spend on its healthcare, the focus on healthcare, how much money they are spending per patient. So definitely treatment in our country is much, much cheaper than treatment in a country like US or Japan. But even despite that, the average amount of money which a average Indian cancer patient can access for his cancer treatment is definitely much lower than the Western population, which may limit the treatment options. So it's a combination of multiple factors. So definitely we are behind those countries in terms of survival statistics, but I think we are catching up quite fast. I think if we have the same conversation in maybe 5 years, we will have very different things to say.
I think fear and probably lack of resources, and let's just say lack of money, could be two big reasons why people are not getting their regular checkups done. And probably this is the reason of the late diagnosis for most people.
Yeah, so I would say one is fear, absolutely. So there is something in our Indian culture actually. So I will tell you, I told my mom, listen mom, you need to get a mammography done.
Yeah.
So she was like कि कुछ मिल गया तो I said कि भाई वही तो मतलब कुछ अच्छा नहीं मिले पर कुछ मिल गया तो अच्छा है, जल्दी पकड़ के उसको ठीक कर देंगे. We'll catch it early and we'll treat it. That's the point of cancer screening, right? So I think it's common and ingrained in all our culture. So this fear ki if something happens, what will we do? It will be a catastrophe for us.
Yes.
What will we do? So it's something written in our genetics, I would say, that it's kind of a mimetic history of our country, is that we have gone through so many crises that people just want ki, let me not go through another crisis.
Yes.
And because of that, people are definitely afraid of things like medical checkups. And I will tell you, even I fall in the same category. Ideally, I want to get my simple blood test done. I want to get them done twice a year. But practically, I end up thinking कि नहीं मैं टेस्ट करा हुआ कुछ आएगा. तो then I have to say नहीं, you don't think like that. You have to get your test done.
You're a doctor.
So I have to physically force myself to go and get my blood test done.
मेरे को भी बहुत डर लगता है.
So everybody is like that, and it's common experience among our people. So definitely fear has a very, very big role to play, and resources and awareness, they have their own thing. But I agree with you that, so keep resources aside, even a person who has adequate resources, because of fear, many times they don't get checked.
हाँ, क्यों हम अपनी जिंदगी खराब करें, अच्छा चल रहा है सब कुछ, पता चले डायग्नोसिस आ गया,
सब कुछ ठीक तो चल रहा है. बिल्कुल, that's what we think. Absolutely.